Welcome to the Medical Marvel podcast, doctors.
Thank you.
So I just love to know the performing art, what you are doing, how this is helping you in a OPD or with how this is connecting you to your patient.
Okay. Actually, my today's topic of talk was Dr. No Dairo. As you know, the Dairo is a culture focal art in Gujarati, and that means gathering.
Gathering.
So
Okay.
this is a gathering of doctors, and you also have experience that doctors are very much stressed. Just before a few minutes, the Sapna passed one comment
Yeah.
that she has not seen any doctor smiling or laughing. So my job today was to make them laugh.
Right.
So it was, you can call it it was a stand-up comedy show.
Right.
In our day-to-day medical practice, what we encounter, funny cases,
Right.
misunderstanding, and it was a fun-filled session for 30 days. Sorry, 30 minutes.
Okay.
So that was the
30
main-
minutes you had a fun way, like making them fun or making them to laugh.
Yeah.
So how this scale is helping you in your career?
Okay. So basically, we are in a, I am at a juncture of my career where the 75% work is done.
Okay.
Now, 25% what is remaining, we are enjoying our life.
Okay.
So, patience is not life. You just keep on seeing the patients. So, I keep on posting medical education videos on social platforms.
Okay.
Almost 4.5 million views.
Wow. Great.
So, mainly on the diabetes. So, that is
Right.
my prime specialty. So, I just keep on educating the patients about the diabetes. And that I tell to others also that you are a real doctor. You are not a real doctor.
Right.
So, whatever content you make, it should be scientifically authentic.
Right.
And we should be authentic to ourselves and as well as to the society. And so, we have to give the facts.
So why, like, no, it is the most important for doctor to make content.
Yeah.
Why it is important now in
Because
this generation?
In medical field, 70% content is fake.
Wow.
A person who is not having medical degree is advising you about diabetes. Someone is claiming that he will reverse the diabetes. Some dietitian is treating the diabetes. So there are so many people who are not specialized, and for popularity and for reach, they are posting the content. So why not an educated person who has spent his life behind the science? He should make the content so that it is authentic and people are become more aware.
So what one message you say to all the doctors who say it is not my job, who know
Look,
but they are not doing for the society?
The history has shown that if you don't change with the time, you will be thrown out.
Okay.
So it is not that you 24 hours you make reels, but whatever knowledge you have, only a small circle of people are knowing that you are very good at your knowledge.
Okay.
The rest of the society, they don't know who you are or how to reach to you. Don't advertise. I never advertise. I have not put my mobile number, my address on any of my content. People will find you.
So it builds automatically credibility, right?
100%. If you are authentic, if you are honest, if you are ethical, people will try to search you and meet you.
So Dr. No Dairo is a unique concept. Can you explain what is this and how it came out?
Actually, I have taken academic talk at national conferences, state conferences. A few years back, there was a stand-up comedy show of mine in Ahmedabad.
Okay.
And since then, I am only getting invitation of these shows. So, just people want to laugh.
How this changed your life?
Actually, what my image...
You think this it could not happen by your medical practice?
Yeah, 100%. Because in medical practice, you cannot laugh with the patients. You cannot make funny comments.
Right.
So you have to be serious because the condition is serious. So we can be little bit friendly with the patients, but with the colleagues, you can open up, you can discuss what the funny incidences are there, and just people get relaxed and they come out of their stressful life.
So if a doctor who is practicing,
Yeah.
like it's not retired, he have a good number of OPD, what in a first 1 minute or a 60 seconds, like 60 seconds, what he have to do? So his patient feel connected or feel respected or seen?
Yeah. What I teach to the young doctors is that always, whenever the patient enters in your chamber, just address him with his or her name.
Oh.
That makes a great impact. Eye-to-eye contact is very essential. What is happening with Gen Z and Gen Alpha doctors, they are always looking at the monitor.
Okay.
They avoid eye contact. And this is perhaps the patient thinks that either the doctor is not interested in himself or herself, or the doctor is lacking the confidence.
Okay.
So eye-to-eye contact is must. Second is physical language, your physical language and your touch. So many of our senior doctors have healed the patients with the touch.
Okay.
Now what happened, because of the corona era, the doctors are keeping distance with the patient. In the corona, they were examining the patient from the 6 feet distance, and still they are sitting away from the
Even they
patient.
feel right now also it is corona is going on.
Yes, you have to touch the patient. What is happening? The assistant is taking BP, doctor is not touching the patient. You have to touch the patient. You have to tap his back if he is doing good with his medicines and his lifestyle modifications, and encourage the patient.
So what 1 or 2 things doctor have to do daily so that he can create a meaningful life in his practice also?
First thing, you have to connect with the patient. Second thing, don't get personal with the patient.
Okay.
Personal rapport is not a good thing. So many people think that making a personal relation is good. Keep some professional distance, but give him a personal rapport. Patient should have confidence in you, have empathy and have sympathy.
So many doctor I see, they say if I talk more to patient, he'll be loyal to me.
Now there are two
1.5 hour.
type of clinicians. One, keep on talking so that the patient don't get time to speak. This is
Okay.
a fact. They keep on speaking in the OPD so that the speaking on the patient's part is limited. Doctor's job is let the patient talk, and when you think that the patient is overshooting, which is not relevant to his illness, which is not relevant to his condition, you have to stop it.
Okay.
You have to intervene in a way that patient don't feel insulted, and patient is assured that at this time he is halted at a very important juncture.
So to young doctors, if they want to grow now, what are 2 or 3 things they have to do?
First thing, you have to learn the public speaking.
Okay, great.
There should not be a stage fear. As the Raj Kapoor was telling, that whole cinema was a big melodrama and Rangmanch. Same way your hospital and clinic is a Rangmanch. Every day a new person is coming to you, new personality is coming to you. So you have to learn some things.
So why, like now, what do you think about in a Gen Z, clinical skills are just a foundations?
The problem with the Gen Z or Gen Alpha is that they are not going to the wards. The examination is MCQ based.
Right.
So what I am telling with my colleagues who are at my age, that after 10 years, 20 years, if I am lying on the ICU bed, perhaps I will be given a sheet of 4 antibiotics and I have to take 1.
Okay.
So problem is the more time is spent with the MCQs
Okay.
and less time is spent with the patient. So that's the problem. When a patient, when a doctor come into the field, he is not having a patient-doctor rapport. He doesn't know how to talk with the patient. He may be knowing all the symptoms, all the signs, everything
He
between
know
the
medically everything, but he don't know how to explain the patient,
Yeah,
how to make
explain,
them understand.
how to talk, how to elicit some signs, how to examine the patient.
Okay.
I tell you, 1,000 tests done are useless if you are not examined the patients.
Okay.
So patient examination and listening to the patient. This is called history of the patient. That opens the Pandora box. If you don't listen to the patient, you will miss the diagnosis.
So listening is a major skill and public speaking is a major skill if you want to get success.
Can
in
I
your
give an
career.
example?
Yeah, please, sir.
Yeah, just I examined a patient who was admitted in the ICU for fever since last 2 months without any proper diagnosis. I went there. In 10 minutes, I just told his relative, you brief me what is happening. He told me that the patient is taking some psychiatric tablet. I told him which tablet. He bought me the tablet. That tablet was the cause of the fever.
Oh.
And unknowingly, the patient's relative was given that tablet even in the ICU. So just listening to the patient, examining what he is showing you and what medicine he is taking makes a big impact.
So thank you very much sharing this knowledge with
Thank
the
you.
our audience and the doctors who can
Sure,
learn
sure.
from this.
Thank you.
Thank you very much, sir.